creating chaos, lack of transparency, shortages of medical resources, or even producing new coronavirus variants. Some Western media also have been criticizing China's latest optimization of its COVID-19 prevention and control measures. However, are these allegations truths? Let's take a look at the 5 truths and fallacies about China's COVID-19 control measures. First, some Western media outlets, including US CNN, have kept claiming that China's easing of COVID-19 restrictions has left the country with, quote, chaos. However, the truth is China is preparing to welcome its annual Lunar New Year holiday, and the Spring Festival travel rush has already kicked off. And this scene can be seen at airports, railway stations, bus stops all across China. People migrating these places orderly, ready to go home or kick off a journey.
I support that the country downgrading the COVID management. It's not easy for our government that protected us and safeguarded our health for over 3 years. I think it's time to do the adjustment.
I am a postgraduate student. Currently, I don't have any plan to travel abroad because I don't have so many leisure time. But indeed, many of my friends who study abroad said they would love to come back this Spring Festival because it's much more convenient.
Second, shortages of medical resources. During the past 3 years, China actually launched a war against COVID-19, effectively handled more than 100 cluster outbreaks, and protected the lives and health of more than 1.4 billion people to the greatest extent. And China has managed to keep its severe cases and death rates of COVID-19 among the lowest in the world. By the middle of last month, almost 3.5 billion COVID-19 vaccine doses have been administered on the Chinese mainland, with over 90% of the population fully vaccinated. Meanwhile, many regional governments have started to distribute health kits to its residents, including fever drugs and health medicine.
The COVID-19 vaccines currently used in China are effective in preventing severe conditions and deaths. Data shows that during the epidemic outbreak period from March to June last year in Shanghai, compared with those who had not been vaccinated, the death risk of those over 60 who had received booster doses of vaccines decreased by 98.08%.
Thirdly, the US Centers for Disease Control and Prevention accused China of lack of transparency with COVID data, criticizing the country's decision to stop providing daily COVID infections number. But don't forget the US itself stopped reporting daily COVID-19 cases since October 2021 and failed to curb the spread of the virus. The death toll in the US climbed to more than 1 million as of last December, the highest in the world. However, as for China, its data sharing with the international community has been instrumental to the cause of anti-pandemic transparency. It reflects on China's sharing of virus genome data to global health specialists, and the Chinese Foreign Ministry has even posted a list of days that China held meetings with the WHO on its COVID situations.
We have kept channels open for close communication at 3 levels with WHO's headquarters, Western Pacific Regional Office, and Representative Office in China. Preliminary figures show that since COVID was first reported, the two sides have had over 60 technical changes on COVID containment, treatment, vaccine research and development, and origin tracing.
One of the most serious accusations about China's control measures is that the current spreading of the virus in the country is creating a new variant that will spread to the rest of the world. However, the truth is currently most of the COVID-19 patients in China were infected by the BA.52 or BF.7 variants. Furthermore, the statement from WHO has made it clear no new COVID-19 variants or mutation of known significance in China has been noted. Maybe some Western media should at least listen to what their experts say.
The viruses that they got were from us, from the rest of the world, and so we've already seen those viruses. So there's no reason to think that more dangerous viruses are going to come out from China.
Last but not the least, some Western reports claim that this winter will be a, quote, dark one for Chinese living in rural areas due to the outbreak. However, the truth is China has made rural area a focal point in the country's current COVID response. The country's 23,000 county-level medical institutions and 350,000 township hospitals and nearly 600,000 village clinics have formed a closely collaborative and efficient health protection system. Over the past 3 years, China has done what it can to help other countries. By the end of 2022, China has delivered more than 2.2 billion doses of vaccines to more than 120 countries and international organizations in Africa, the Asia-Pacific, South America and Europe, fulfilling its commitment in building a community of common health for mankind. Yu Yang, CGTN, Beijing.